Welcome to the podcast. So today we are going to talk about a doctor's visit and things you might cover in that, at least for our men. So if you're going to the doctor and you have been noticing some changes in your erection, how does your doctor know about those changes?
Are you bringing it up? Are they giving you a questionnaire? Are you answering any questions about it? Who's
Yeah.
initiating the conversation? That's what we want to know.
And we would love for you guys to share, subscribe, send to friends so that we can get input in the comments on how you approach that in your doctor's office. So say it's the first time you're in your 40s and maybe you're drinking, maybe you're not, and you lose an erection, over the weekend. And that's progressing a little bit because even one time is going to affect psychologically the next time or in the future because it's never happened before and now all of a sudden it's happening. What is this? It's going to happen all the time. If you're drinking, okay, maybe you're attributing that to drinking, but then all of a sudden it happens when you're sober. So if this sounds familiar at all, and then all of a sudden you're going to the doctor, maybe even making the appointment because of it, but it's your primary care doctor and do you bring it up? So we want to know what happens because does your doctor actually screen for that when you go in? Do they give you that questionnaire and what does a questionnaire look like for that? So how do we know as doctors whether you have ED? Well, number one, we need you to tell us so that we can ask more specific questions and have you answer some questionnaires on that.
And that may be a visit where the men are coming in and talking about erectile dysfunction. It could be, hey, I've noticed I've started to slow down. I'm starting to see some age-related changes. And then from there, it's on us to kind of pry a little bit and say, well, what are those changes? And a lot of times we're having to ask, are you noticing a decline in sexual function? And that's usually what will trigger that conversation, even though that's one of the things that you guys were coming in hoping to discuss anyway. But it could be a hormone conversation. It could be an ED conversation. It's what's triggering it.
Yes, correct. And again, I don't think you guys are ever hoping for us to discuss it because we always discuss it. But but your primary doctors, you may be. So, like, again, I think by the time a lot of men come to us, they've already failed that conversation with the urologist or the primary doctor, one of the two, or both. And so, but Faraday's right. If you're coming to us for hormones and we're going to talk about sexual function, and if it's all good, it's a short conversation, but we're still having it. And then if you're coming to us for sexual function or sexual changes, erection changes, then we're having those conversations. And your forms you're filling out initially are answering all the questions we need. So
so we have screening questionnaires.
We do. So again, both our men and our women get some screening questions about sex. And so that doesn't happen too often that you go to your primary care doctors. And that's what we kind of want to know. Like, are they addressing it just as a screening tool? So the questionnaires that we have, there's two main questionnaires. Like, ultimately, it's all on one intake form. But the first one is like an erection hardness score. And that actually is, again, 4 questions. So erectile hardness score. So 4 questions, basically. So the first one is your penis larger but not hard? So like that's like 1. So that's going to be the very, your function significantly changed or reduced, right? And on the other side of that, on number 4, so there are 4 questions, is you're completely hard and rigid all the time. So no changes whatsoever. So that's one of the scores, but then we go a little bit further.
We do, and we look at what's called a SHIM score, or the Sexual Health Inventory for Men. So there's a long form of this and a short form of this. We utilize the short form, so you guys aren't filling out these questions for 20 minutes in office and just going through the 5 questionnaires, or the 5 questions on that questionnaire. Those 5 questions discuss a range of things, so not a little bit different than the first. If you want to go in to some of those.
Well, and so this is technically the International Index of Erectile Function, if ever you have seen that pop up. So basically, It is 5 questions and it's a score of 1 to 5. So the bottom score is a 5 and 25 is the highest. So if you're a 5, maybe even sometimes prostate cancer, prostate surgery immediately after or further out, or older and your function isn't, you're not functioning, that is a 5. And then 25 is you're functioning fully. You're young and you're in your 20s and you don't have any changes that you've noticed. And we still get those men looking for some kind of enhancement occasionally. And so, but it's 5 to 25. And so basically then it's a range. You either have some, it's mild, you have mild to moderate, or you have severe erectile changes. And so those scores go a little bit further when you actually look at those. Then you can see that there's a significant incidence of erectile changes and decline that happens in the 40s, and it's approaching 40%, not quite there. And then it gets worse with age in 100% of men after 80. And so having those conversations early on, because obviously if it's more mild at 40 and only 40%, but 100% at 80, you want to catch it early. So doing the screening test are important, but I think that if it's not being done, then they're definitely coming to us looking for other solutions. And these are the scoring systems. So this is how we know you're actually giving us the information. We're just asking the questions.
And then treatment is based on severity.
Mm-hmm.
So that's how we know what options we need to be recommending to you guys based on that score. Like Dr. Durr said earlier, by the time you guys get to us in our clinic, primary's failed, urology's failed, or they gave you partial solutions.
Mm-hmm.
So just a supplement, I've had guys that come in and say, my doctor told me to diet and exercise. Well, that is extremely important. That doesn't help the here and now.
Correct. Well, and I think that we would love to hear feedback about what's happening and have conversations that might happen more easily with comments and some feedback about experiences. So my guess is that in the primary care doctor's office, it comes up if there's changes in maybe a prescription written, and perhaps, some supplements related to it. So we would love to hear that. And that's probably the first steps. And then probably referral to a urologist if those have failed. And so if that is the case, or it's different, or you guys are experiencing something, that's different than what we're thinking, we would love to hear about it, because I feel like these scoring systems are a good way for you to know what those numbers are, and for your primary doctor to also guide treatments. And so again,
this podcast is because of comments. So we do read our comments. We do look at our comments when our viewers ask, well, what scoring do you use, or what should we be looking at, or how do you know how severe my erectile dysfunction is? This is what we utilize: the erection hardness score and the sexual health inventory for men.
Yes. And again, those give us a more standardized way of scoring and objectively, and then deciding on treatments related to that. And so that's how we would know, and that's how your primary would know, and that's how you know, because a lot of these are just based on conversation. So if there's any experience you'd like to share, we would love it. And leave some comments. Let us know if there's anything else you want to hear about, because we are willing to deep dive into anything sexual wellness.